Welcome to Wellness Wednesdays, a web series where we examine how COVID-19 has impacted our healthcare system and what you need to know as you re-engage with your physician and get the healthcare you and your family needs in 2022.
April is Minority Health Month, and today on Wellness Wednesday, we're here to discuss the healthcare disparities that exist in our community and UT Medical Center's response to those disparities. What COVID has done is really expose the difference in outcomes as relates to health in all sectors of our community, not just related to COVID, but related to heart disease and cancer and other things. So here we're focused on those members of our community that have poorer health outcomes than others. Disparities or differences in outcomes as it relates to health have existed for a long time. Historically, we've focused mainly on race and ethnicity, meaning African Americans and Hispanics having poorer health outcomes than other members of our society. And we really didn't have a framework to hang that on until probably a decade ago. And when we realized that it wasn't related to their race or ethnicity directly, it was more related to the conditions in which they live. And so, when you're more likely to live in a multi-generational household, or when you're socioeconomically stressed, when you're less likely to exercise, when you're less likely to have access to fresh fruit and vegetables, that makes you vulnerable to all types of diseases and poor health outcomes. Same thing related to COVID. Those same populations that were vulnerable pre-COVID became more vulnerable during COVID. So what our findings have taught us is that there's not a one-size-fits-all prescription. Different people, different demographics warrant different approaches. And so, serving an urban population may warrant a very different strategy than serving some of our rural patients that live out in some of the outlying counties. Communicating with an African American or Hispanic population, or even a population that doesn't speak English, warrants different strategies than dealing with an English-speaking population that is a majority population. Yeah, so I think I'll pause here and take the opportunity to really acknowledge what happened in our community. That's unique, I think. First of all, the partnerships that were formed between the health systems and with the Knox County Health Department and with our city and county. Through those partnerships, we were able to mitigate some of the disparate outcomes that were seen in other parts of our country. Specifically, as we talked about before, African Americans and Hispanic populations were more likely to be hospitalized and more likely to die. We did not see the increase in death rate among those minority populations in our own community. I think we learned from what was happening west of us and north of us, and we responded appropriately and strategically to prevent that disparity in death rate. So I just want to call that out. I think where we go from here is that we've got to focus on those chronic conditions that made our minority populations more vulnerable. Obesity, managing chronic disease such as heart disease and diabetes and high cholesterol, so that when heaven forbid, the next wave of COVID or the next pandemic shows up, we won't have the same vulnerability for the same populations of people. I'll start with African American men. The number one piece of advice I would give is get your screenings. We know that you can be screened for colon cancer, and colon cancer can be prevented with colonoscopies. We know that African American men are 50% more likely to have prostate cancer and 100% more likely to die from prostate cancer. We can prevent that with PSAs and digital prostate screening. For women out there, African American women, again, you are also candidates for colonoscopies, and we can prevent colon cancers with that. We know that you're equally likely to get breast cancer as your white women colleagues or counterparts. However, you're 40% more likely to die from breast cancer. And so mammograms or breast cancer screening becomes that much more important. And then lastly, cervical cancer screening through pap smears. So if you're watching this, I just want to again summarize by saying the University of Tennessee Medical Center, as the region's academic medical center, is committed to providing access for everyone in our region to high quality and safe care. We do that by trying to provide primary care access in all of our counties, and you can find out where those locations are on our website at utmedicalcenter.org. But also, if you don't have a primary care physician or you're fit into one of those vulnerable populations that we talked about, I can also also advocate for you contacting our healthcare coordination line at 865-305-6970.